Why not?
Why not? All right.
Then you gotta do that. Are you okay? Yeah. All right. Live from Jenna's Lounge, here's what's on tap.
Hey.
Hello. I am Shelby Kisling, sitting in for Steve Walters today, and I am here with Sara Finger, the founder and executive director of the Wisconsin Alliance for Women's Health, and Nicole Safar, who is the VP of Public Affairs for Planned Parenthood of Wisconsin. Thank you both for joining us today.
Thank you.
Thanks, Shelby.
I would love to hear about both of your organizations, what you do, who you serve, and various services you provide.
Well, I can start. The Wisconsin Alliance for Women's Health is 13 years old this month. We were started to really help make sure that policy in Wisconsin happens with women and girls rather than to us. We believe that if you're not in the kitchen, you're on the menu, and so we work every day to make sure that women are informed, inspired, and involved to make a difference. And we believe that every woman in Wisconsin at every age and every stage of life is able to reach her optimal health, safety, and economic security.
Hi. Okay. So Planned Parenthood is Wisconsin's oldest and largest reproductive health care provider. We have been serving patients in Wisconsin for 82 years. We serve 60,000 patients across the state every year at 21 health centers. And at Planned Parenthood, we do the full range of preventative reproductive health care, STD testing and treatment, cervical and breast cancer screenings, birth control, education and services, well-woman exams, and abortion services at 2 of our health centers, one in Madison and one in Milwaukee. And let's see, we serve mostly women, but about 10% of our patients are men, so about 8,000 men every year. And and 2/3 of our patients are under the Medicaid program.
Wow. Excellent.
Oh, sorry.
So let's jump right into the federal policies that are going on in the new Trump administration. Talk a little bit about that, how it would impact your organizations and women in Wisconsin and across the country.
So I think one thing we can unequivocally say about this healthcare bill is it is the worst piece of legislation for women's health in a generation. The very deep cuts that it makes to the Medicaid program are just the tip of the iceberg. 1 in 5 women in this country is on the Medicaid program, or 1 in 5 women of reproductive age, is under the Medicaid program. And it would really cut access off for hundreds of thousands across the state. When it comes to Planned Parenthood, the bill is terrible in that it prohibits Planned Parenthood from being a healthcare provider under the Medicaid program. So that means that the nearly 50,000 women in Wisconsin who qualify for Medicaid and who go to Planned Parenthood would not be able to come to us any longer under that program and would not have another place to get their health care.
So there's a lot of rhetoric you hear on the cable news networks about defunding Planned Parenthood. Is that what that means? Then if you could put it in more literal terms for people to understand what that means. What does it mean to defund Planned Parenthood?
Sure. So the way that Republicans in Congress talk about it, and that Speaker Ryan talks about it, he makes it seem like there's a line item in the budget for Planned Parenthood. Like Planned Parenthood just gets a chunk of money under the federal government, and he's going to take that away because of whatever his problems are.
And that's not the case.
And that's not the case. Planned Parenthood is like any other Medicaid provider, and we bill Medicaid for every patient we see and the services that patient gets that day, just like anybody else.
Just like any other healthcare provider.
Just like any other insurance plan that we bill. And what Speaker Ryan's proposal would do is cut Planned Parenthood out of the program and say we are not an eligible Medicaid provider because we provide abortion services in his reasoning. An important thing to know is that in Wisconsin, Medicaid does not pay for abortion unless you will die. So there is not taxpayer funding in Wisconsin going towards abortion services.
And talk a little bit about at a state level. Are there different legislative items coming up or policy that have happened recently to affect access to health care, or what do you see coming down the pipeline?
There's a 7-year history of this. We for a long time, probably for the last decade, a lot of the attention's been on federal policy and federal legislation and decision makers. But we've seen nothing but gridlock nationally. And now, of course, since November 8th, you have a supermajority out in D.C., and they're still not getting anything productive done, right? And so Nicole and I have been very proud to be involved with organizations that are trying to make sure people pivot from what's also happening federally to what's been happening at the state, because the greatest damage that's been done in terms of women's health care in this country has been done in the state of Wisconsin and in all states around the country. And so we've done nothing but play defense, unfortunately, for the last 7 years. But for every bill that we're fighting against, we're very proud to stand for some positive, proactive, bold, visionary pieces of policy like the paid sick leave or paid insurance, family leave, and paid sick leave in Wisconsin. So we just really encourage anybody who is all paying attention to what's happening in D.C. right now. They're attending town halls, they're doing marches, they're following Trump left and right, to remind them that, again, most of the damage that's been done is in the state, and the most of opportunity to fix things and advance positive policies are going to be here in Wisconsin.
So how is Wisconsin different? Are there policies here that are better than other states? Are there some that are unique? Is there a pattern? What would you say is the state of Wisconsin?
You're giving me a chance to sit here with my friend and a beer right now, and I'm just going to vent for a second and recognize that Wisconsin is often overlooked as one of the most hostile states for women's health and women's reproductive rights in this country. Everyone looks to Texas or Mississippi, but oh my gosh, we are right up there with them when it comes to the bad pieces of threats and policies passed. And so it's not easy to be in Planned Parenthood right now in Wisconsin because of all the restrictions. It's not easy to be an advocate right now because everything's stacked against us with a supermajority that was in since 2010.
One of the first things Governor Walker did in his first budget in 2011 was he took away all of the state money that Planned Parenthood received for doing reproductive health care in the state of Wisconsin. The state of Wisconsin also has a women's health block grant, essentially, and Scott Walker took all that money away from Planned Parenthood. It was about $1 million every year that we used, again, for our preventative reproductive health care. And as a result, since 2012, we've closed 5 clinics that we haven't been able to keep open without that state funding. Those clinics have been in places like Shawano and Fond du Lac and Chippewa Falls, and nobody else has stepped in to provide that care. There have not. You often hear Governor Walker or Speaker Ryan say, "Oh, well, women can go anywhere for that care. It's really easy to get reproductive health care," and I think women across the state know that that's just not true.
So where do they go? What happens?
We don't know.
They're not going. I mean,
they're
women
not
are falling
going
through the cracks. So not only do we have a closure of primary care clinics, which a lot of women relied on for quality, confidential, affordable health care, but we also, have an affordability gap because our state didn't fully meet the promise of the Affordable Care Act, which is now obviously being threatened. The idea that we didn't fully expand Medicaid created a huge problem for people actually being able to afford their new health care services. So we are very aware of how many women are vulnerable to falling through the access gaps in the state.
Because we're also such a rural state, we have a women's health shortage. It doesn't matter if you're on Medicaid or if you have private insurance. We have a shortage of women's health providers because of the geography and demography of our state. So it is not easy to get basic health care if you're a woman. If you're a poor woman and you don't have a Planned Parenthood in your community, it's nearly impossible.
So maybe this is asking the obvious, but what impact does that have not only on women down the line years and years from now, but the rest of the family or communities when they don't have access and they can't access, especially if you're in a rural area? What is that bigger picture?
It really compromises women's well-being overall, right? But we know that women, most of the time, are the coordinators of care for their family and are leaders in their community, are part of the workplaces. It really compromises the ability for women to play that central role in society. Just on a flight with my 2 young kids, and of course they tell you first, put on your mask first if something goes wrong with the plane, like take care of yourself first. And there are major sacrifices being made right now with women across the state and the country who are not taking care of themselves because of affordability, accessibility, because of just stigma around mental health and reproductive health and things that we need to be our healthiest.
I think the sort of bottom line is that this healthcare bill and the policies of the current Republican Party make it more difficult to prevent an unintended pregnancy, make it much more difficult to have a healthy pregnancy, and make it nearly impossible to get affordable health care for your family once you have children.
Well, and can we go there, right, with the affordable? No. the American Health Care Act, ACA, when we go there and you look at that, not only is it preventing you from getting care, but it's penalizing you for being who you are. I myself have an anxiety, a panic disorder. If the ACA goes away, I could be demonized for having something I was born with. Also, I have a blood clotting disorder. All those things are going to be some pre-existing conditions that I will not be covered by. Or if I am given some coverage, it's going to cost me an arm and a leg just to make sure that I could treat myself for the things that make me me.
And can you clarify for people, with repealing the Affordable Care Act, does that mean it will only impact people who currently are on Obamacare, on the Affordable Care Act, or is it going to
Here's what's really important to know, is that Obamacare is everything. Like, it's not just if you got into the marketplace. It's not just if you are on Medicaid. Obamacare has impacted every single one of us because of protections that have been put into the employer-sponsored insurance. Right. And so now my protections in the employer-sponsored insurance, I can't be charged more because I'm a woman. I can't be denied pre-existing condition protections. I have to make sure that for 80 cents of every dollar I spend on healthcare, it goes towards healthcare costs and not administrative costs for the insurance. So there is not one person who's not impacted by the Affordable Care Act or Obamacare. And so when we talk about it being repealed and replaced with this just
it's being replaced with a tax cut. That's what it's being replaced with.
And not for us. And so this replacement, all of it right now is it's devastating to any single person who needs healthcare access, which should be anyone who has a heartbeat. Come on. Sorry.
Yeah. Well, I actually have a question from a viewer. Kathy Cogswell would like to know what services Planned Parenthood provides for a healthy pregnancy.
So one of the things that Planned Parenthood does, actually the bulk of what we do, is help with planning and spacing of pregnancies. So all of the research around access to birth control has really found that one of the single most effective things we can do so a woman has a healthy pregnancy is to make sure that it's planned. And that is the nature of birth control, right? So we do a lot of that education and provide those services. We also do a lot of pregnancy tests for women who come into Planned Parenthood who think they might be pregnant. And as I mentioned, a vast majority of our patients are on the Medicaid program. So we help enroll them into their prenatal care, and we give referrals for prenatal care to make sure that there's not a gap in care in between when a woman's trying to get pregnant and then when she actually becomes pregnant.
No, the spacing issue, oh my gosh. So I tell you, being able to, the healthy with infant mortality and birth outcomes right now is so critical in this state. And we need to figure out, again, how to help people be as prepared as possible for a healthy pregnancy. And any subsequent pregnancies are spaced in a manner in which that first pregnancy and that woman can recover and economically and physically be prepared for any subsequent pregnancies. And so I'm a past patient of Planned Parenthood. I am still dependent on my ability to plan and space my pregnancies. And so I think Planned Parenthood is one of the greatest supporters of birth outcomes and healthy women in this state, and that's why I fight so hard to make sure that they are protected.
And while we're talking about Planned Parenthood, I know it's a very well-known brand surrounded with a lot of different opinions and controversies in the media. Are there any kind of misperceptions out there that you think need to be corrected, or people don't quite understand or aren't informed about that you'd like to talk about?
So that's such a good question, because 1 in 5 women in our state have been a patient at Planned Parenthood. So among women who have struggled to get access to healthcare, basic healthcare, or who have been trying to plan and space pregnancies, there isn't misinformation, because women know what Planned Parenthood is. Women know that they can always come to Planned Parenthood for trusted, confidential health care. Where there does seem to be a lack of understanding is in that building right behind you in the state capitol. And there's a lot of misperception, a lot of mistruths about Planned Parenthood and the work that we do. And it really is kind of, I don't understand it. I absolutely understand the issue of abortion and how there are many different people come to that issue with their own values, with their own life experiences, and we don't all have the same opinion on abortion. That is not anything that Planned Parenthood would ever try to change or sway for a person, and we absolutely respect everyone's position on how they feel about issues of parenting and abortion. However, I think what most people can agree on is that it's not the government's job to get involved in that decision, and the people in the state of Wisconsin know that. Almost 80% of the people in the state of Wisconsin support Planned Parenthood and the health care that we provide. But in the state capital, that number is drastically reduced because of the politics that have been inserted into reproductive health care.
Yeah, at the end of the day, we have to stop playing politics with women's health. We have got to embrace our common sense, our common vision for healthy people, people that are economically secure, people that feel safe in their homes, their community, and in their futures. And that's why, again, policy is everything. And I really hope anybody who's listening and watching right now understands not only what's at stake, what's going on in DC, but really pays attention to what's happening here at the state, and organizations like Planned Parenthood and their advocacy department and the Alliance for Women's Health is really here to commit to inform you, to involve you, and to inspire you to be ready to engage and make a difference.
And maybe we can just end on this thing. Why is it so important for people to be informed about this, and women in particular? Why should they be educated on issues surrounding healthcare?
Because it's either going to happen with us or to us. And I'm sorry, but, for too long, I know people are busy, and I know it's really hard to make time and to understand where, to weigh in. But one way or another, we have got to figure out how to inform this process and to influence this process, because right now we're on a dangerous trajectory that's setting us back decades, and it's really not only going to turn back the rights that we've had and fought for so many decades, but it's going to compromise our health, our well-being, and ultimately maybe even sacrifice some lives. I mean, this is really serious stuff.
It's important to be engaged around these issues because our engagement works. We can impact the process, and our elected officials sometimes rely on how busy we are and how people aren't following the process and how it's confusing and how they can easily sort of distort things. They rely on that to push through policies that benefit a very few and don't benefit the community as overall. But when we do speak out and raise our voices and say, hey, wait a minute, I want to know why you're doing this. I want to know what the impact is going to be on my community, on my family, on my health care. It makes a difference. And we saw that with Paul Ryan's bill. I mean, he wanted it passed in February, and it took months and months to get it through. And then they had to sneak it through in the middle of the week without having any information about how much it was going to cost us, who was going to lose their health care. Now we know 23 million people are going to lose their health care under this bill. It's going to cost millions and millions of dollars for the states.
No, this awakening is beautiful. This engagement is beautiful, but we have got to figure out how to sustain this, because this is not something that happens overnight. Nicole and I have been doing this for 13 years. We've had victories few and far between, but you have to keep at it. And again, organizations like ours are here to help make it a reality in your busy lives, and again, this kind of uncomfortable atmosphere in. But I'll tell you, less than 7% of people in the state of Wisconsin know who their state legislators are. So that is scary as heck when you consider that we have to be paying attention and engaging. So I got to make a plug for this website. It says whorepresentsme.info. Whorepresentsme.info. Go to it, find out who represents you down, from federal down to local, city, county, and find out, because we cannot afford to sit back and not call them out when, one, know who they are, know what they're doing, and then to engage with them because they work for us.
It would just drive you to drink thinking about it.
It would drive you to drink!
One other thing I think is really important when we're talking about engagement, especially, I think, women, run for office. Because it's not just about speaking out when something impacts your family and your health and your community. You have an important perspective, and it should be reflected in your government. So I have really been inspired by so many of the women that have come out this last year, so many Planned Parenthood patients who've never told their story before, who said, I thought that, this was just like normal and didn't think that it was a big deal. It is a big deal, and some of them are thinking about running for office now.
How does a woman who's thinking that get involved and start running for office? What?
there are great organizations out there like Emerge Wisconsin, Emily's List. Planned Parenthood can get you connected to those.
New Leaders Council.
New Leaders Council, Wisconsin Progress. Really great organizations that do candidate training. But as a first step, if people are looking about ways to get involved in their community, definitely Planned Parenthood and the Alliance, we're doing events and advocacy in the community all the time.
Very good information. Well, I thank you both for being here today. And now we sing and we dance and we drink more beer. And we swag you.
And you swag us.
And have a coaster.
We get to put hats on?
Yeah.
Okay, here we go.
Awesome.
We're piling on
Oh,
stuff
it's too
from
tight.
Swag Wagon.
There we go. Thank you.
Very good.
Thank you.
And
We got
Steve's
Sarah
never coming back.
Don't down my foot back. You look good, Nicole.
Thanks.
I love it.
I like the pig.
You're getting
Does
pearlish.
that make it authentic?
Yes.
Yes.
Mini pearlish.
Fine.
Woohoo.
Over and out.
And over and out.
And over and
10-4.